Welcome back to Matter of Fact and our state of addiction coverage. The Centers for Disease Control calls the opioid crisis in America an epidemic. Last year, more than 64,000 people were killed by drug overdoses. And the stark reality is 175 people die from a drug overdose every day, nearly two-thirds of those linked to opioids. On Wednesday, about a week after President Trump declared a health emergency, his Commission on Combating the Epidemic released its final report. In it, 3 important recommendations. Number 1, establish drug courts in every federal judicial district. Those courts would increase access to treatment. Number 2, change the reimbursement rates for addiction treatment. The point of that would be to incentivize the prescription of more non-opioid treatments over highly addictive drugs. And number 3, streamline existing funding into state block grants, the goal to increase flexibility at the local level. One member of the president's commission issued his own list of recommendations. Former Democratic Congressman Patrick Kennedy battled his own addiction and mental health challenges and now focuses his time on national advocacy efforts. It's so nice to have you back.
Great to be with you, Soledad.
I read some of the top recommendations that came out of the commission, but you say you don't think that it's gone far enough. What do you think is missing from that?
Well, the big thing that's missing is the money. I mean, it's like the old saying, show me the money. You can't be serious about this unless you address it, whether it's the insurance industry paying for addiction treatment in the same way they would pay for any other chronic illness, diabetes, asthma, cardiovascular disease.
Did the commission recommend more money?
We recommended, 1, that the insurance industry comply with the parity law, which means that they have to pay more. They should be anyway paying for this. It's the same illness as any other illness of the body, and it's being discriminated against because of prejudice, plain and simple. But federal government needs to up its funding. And frankly, the best way to do that is within the current Affordable Care Act, because only through insurance can people gain access to coverage. If they're trying to access treatment through block grants, the money will run out 2/3 of the way through the year if there are other budget demands. We need chronic care management, and the only way to get chronic care management is through stable insurance coverage.
Doesn't that beg the question, is there really political will to solve this problem, right? I think it's one of those issues where people will go and embrace the issue because it reads well on television, right? It reads well to constituents. But do people really want to change the issue? There's no money. There's no additional money.
Well, it's interesting because in New Jersey, Republican Governor Christie has appropriated over $200 million just for New Jersey alone. That's nearly half of what the Congress appropriated for the whole country. If you extrapolated what we spend in New Jersey on the opioid crisis across 50 states, we'd be at a minimum of $10 billion a year. So my starting point is if the Congress doesn't appropriate at least $10 billion a year, which, by the way, is half of what the Congress appropriated during the height of the HIV/AIDS crisis. $24 billion for HIV/AIDS, where we had 50,000 people a year dying. This crisis is claiming over 63,000. Frankly, Soledad, I think that number is way underreported, given the stigma of this illness. So I would say that we have to, as a minimum, appropriate $10 billion a year, if not $20 billion a year.
You've said you would like to see the social media giants do more as well. Who are we talking about when it comes to social media giants, and do what?
Well, they can reach out to folks through social media in a way that a generation ago we used network TV to do. And so it's up to them to come up with the solutions. But frankly, what's involved here is a holistic approach. We need everyone in this country. We need the insurance industry to step up. We need the medical establishment to step up, the federal government, the giants in technology and in the pharmaceutical industry. The bottom line is there's no one who can say that's someone else's problem. And so the real pain point for this administration will be, are they for reducing taxes or are they for reducing the death toll? Because you cannot reduce the taxes upwards of 15%, which is going to cost $1.5 trillion. At the same time, you're reducing the Medicaid coverage, nearly $1 trillion itself.
Former Congressman Patrick Kennedy, nice to have you. Thank you.
Thanks, Soledad.